Well, prosthodontic training requires the dentist to make all of the prosthetic work that they are going to install in patients' mouths during their 3-year residency training program. So, as you can imagine, learning the actual how-tos of any given skill set are what allow you to judge the quality of work that you're going to be dealing with actually for the rest of your life. And the reason that there is such a thing as prosthetic dentistry training is because the laboratory industry needs supervision by dentists that understand what it takes to do proper treatments. I think a lot of people, even dentists, think that a dental laboratory industry has some form of training that allows them to know how to design prostheses for patients. And actually the laboratory industry is a subset of dental profession where the skills and methods are taught actually by dentists that know how to do these procedures.
Well, and I think the public probably thinks that dentistry, like medicine, that if you send your blood work into a lab, there's trained professionals who test that blood. If you're more sick and you have to have blood gases or you have to have an MRI, in medicine it is still a formal training program to become the person testing your relative health. In dentistry, we had 56 schools that taught dental technology training up until about 10 years ago, where you could go to these schools and receive a certificate of training. The last I heard, there were 2 of them left. And comment on how our dental laboratory technical field gets to actually become an employee at a laboratory.
Well, I think it's important to retrace the history of the lab industry. And these numbers that you've mentioned are actually inconceivable. So what you're saying is that 30 years ago, there were 50 or 60 technical schools that trained laboratory technicians. And these schools, incidentally, usually were supervised at some level by prosthodontists. Prosthodontists are the ones that wrote the books on how to make dental prostheses. Over the years, like all technical education in this country, the quality of education has declined as more and more students with the intelligence to learn these skills have gone off to college. So, like many of our technical fields, the best qualified technicians that could have been trained to do dental laboratory procedures are now going to college. In other words, there are other more desirable professions for them to go into. And so we have no one entering dental technology schools. So who's doing the dental laboratory work now? Well, anybody who wants a job can get into doing the dental laboratory technology.
And the problem's multifactorial. I have to blame our industry on the problem. There's been a downward economic trend in dentistry where the average dentist will not pay a premium for good quality prostheses anymore. So when you remove the incentive for talented people to get into an industry by removing their ability to make money, then you're going to attract a different caliber of person. And without a formal, organized training program, it becomes an apprenticeship, so that your non-qualified people are teaching your new non-qualified people how to do something that for most of the time is an inadequate level of quality.
So there's been a true breakdown of the educational system that had been in place to train dental laboratory technicians.
It's been decimated. So we have very few formally trained technicians. So that's why practices like ours have to take control of the laboratory component themselves. And we do that at the expense of our personal lives. We end up setting our own teeth and making our own prostheses much of the time because we're not willing to settle for the average level of quality that's out there in the industry.